Guys, this is Mobeen. We are talking about the pulmonology. This is the pathology of the obstructive lung diseases. The topic today is the asthma. Asthma is defined clinically as the paroxysmal, which means intermittent, paroxysmal, possibly allergic inflammation of the airways, which is accompanied by wheezing, cough, breathlessness and chest tightness, mostly during the night or early morning. So that is the definition of the asthma. It is an obstructive disease. Patient normally experiences this when they are trying to exhale. So in that symptom, it is similar to emphysema and chronic bronchitis or COPD. How this is dissimilar from COPD is that it is reversible, mostly reversible. That means you can administer drugs and you can bring the airways back almost towards normal. In the chronic bronchitis or in emphysema, you cannot reverse them. You can stall and reduce the progress of those, but you cannot reverse them. Also, asthma is also chronic. COPD is also chronic. Now, asthma is primarily, it has three primary problems that you should see. So as we will do the pathogenesis here, what I would encourage you is to look at three problems. There is a triad of issues. What are those three issues? Number one, you have the airway obstruction. Number two, you have smooth muscle, or the patient has smooth muscle hyperplasia with hyperactivity. And finally, patient has inflammation. These are the three basic pillars, three basic problems. So when you are looking at the pathogenesis or pathology of the asthma, you have to figure out how will you cause airway obstruction, how would you look at smooth muscle hyperplasia and hyperactivity, which is called the bronchospasm, and how would you cause inflammation. That is one. Secondly, asthma can be phasic. What that means is there is an immediate allergic reaction. Most of the time it is allergic. There is an immediate allergic reaction and then there is a late phase allergic reaction. So that means people may have an immediate asthma attack, become okay, and then a few hours later have a bigger attack which might go on for a day or more.